there is more information than there ever has been for patients with tinnitus. There are no two tinnitus patients that are exactly alike. Every person's tinnitus is different, and the impact of the tinnitus on that person's life, their overall well-being, as well as their relationships, is different for everyone. And I say this as somebody who has tinnitus and understands the impact that it can have and how it can fluctuate from day to day, from hour to hour.
Hey everyone, welcome. This is Ben Thompson here with the Pure Tinnitus video podcast series. This is podcast episode number 5. We are here with Jack Scott, who is a Ph.D. audiologist. And Jack earned his Ph.D. at the University of Texas, Dallas, at a well-known hearing and balance and tinnitus center in Texas. He has served as a clinical audiologist and a clinical faculty and lecturer at Northwestern University in Chicago, Illinois. So he has experience at some of the most renowned centers for hearing loss, hearing aids, and tinnitus treatments in the United States. And he's here with us to share some of what he has learned along the way.
I am a lecturer at Northwestern University. I teach a graduate level course in tinnitus to the Doctor of Audiology students there. And previous, I shouldn't say previous to that, but I've also been a clinical faculty member at Northwestern prior to joining GN Hearing in their research and development. And so it is true that we've had to take the course online. It is a seminar course, and the course that I teach covers tinnitus. It covers sound tolerance issues, and more specifically, it kind of digs into the way to be able to determine if someone has what's called a tinnitus handicap. That is, if tinnitus is impacting their overall quality of life through questionnaires and counseling. They also learn about different aspects of tinnitus, what can exacerbate tinnitus, what causes tinnitus, as well as some of the sound therapies, the therapeutic processes out there for tinnitus. So we cover both the medical, such as surgical, pharmaceutical components of tinnitus remediation and tinnitus relief, as well as the non-medical components, those that may apply more towards the audiologist, such as the implementation and application of hearing aids for sound enrichment, in addition the use of sound therapy, either through some sort of bedside device that makes a fan noise, or the use of hearing aids that may have some sort of sound generator within it, or other additional apps that are available on the market to be able to provide support for patients with tinnitus. As part of my course as well, I also invite a cognitive behavioral therapist to come in to speak to the audiology students about that aspect, so more of the psychological components of tinnitus and some of the psychological therapies that can be applied for tinnitus patients, in addition to the use of amplification and sound enrichment components.
Thanks so much. Now, as we know, tinnitus care is not only hearing aids, but it's a huge, important part of it. What are the main takeaways that you want your students to leave your courses as they go into the field, into the clinics, working with patients who come with tinnitus and may or may not have a hearing loss? What are those important points that you want to make sure are being communicated to the patients?
So I think what you're saying is spot on. I mean, there are patients out there with tinnitus that don't have hearing loss, and so one of the more important points that we point out is, how do we quantify the impact of tinnitus on that patient? We also discuss ways of measuring the tinnitus as well, and then focusing on some of those therapeutic sides, so the psychological, the use of cognitive behavioral therapy, the use of sound enrichment. And what I really want the students to take away from the course more specifically is that there are no two tinnitus patients that are exactly alike, I should say. Mm-hmm. Every person's tinnitus is different, and the impact of the tinnitus on that person's life, their overall well-being, as well as their relationships, is different for everyone. And I say this as somebody who has tinnitus and understands the impact that it can have and how it can fluctuate from day to day, from hour to hour. And so while we do psychological, or I should say handicap assessments through questionnaires, realizing that those are merely snapshots of that person's life, and it's important to understand the overall gestalt of the patient and really dig into the counseling aspect and learn what truly can drive this person's tinnitus, what things they found to be able to benefit them with their tinnitus, and understand the overall implications of it.
Thank you, Jack. Guys, we're here with Jack Scott, who's a PhD audiologist who earned his PhD at UT Dallas in Texas, and now is a clinical faculty and lecturer at Northwestern University in Chicago. So in the United States, those are two well-known institutions that have a high quality standard for research and for clinical practice in audiology and tinnitus care. So Jack, in your years working and being involved with tinnitus research and working in clinics, what have you seen over the years? You know, I'm a millennial audiologist myself, so I'm more new into this game. And there's people out there who are looking for help. There seems to be these new treatment that come up every now and then. Neuromodulation to me was one that seemed promising, but is now losing interest. What have you seen with the trends over the last 10 or 15 years?
Well, it's probably a little bit more than that for based on my age and my clinical practice. But I think one of the things that's really exciting within the world of audiology and what's really beneficial for tinnitus patients is that we do have this evolution of therapeutics that are available, both medical and non-medical. I know when I first started practicing in clinical audiology, we were very limited on the use of tinnitus maskers, either for patients with or without hearing loss. More specifically for patients with hearing loss, it was one or the other. Either you wear amplification or you wear a tinnitus masker, but you can have both. And where now we have both the combination of tinnitus maskers and amplification. And then also at the time, open ear hearing aids were relatively new and coming on the market. And these are devices that actually could be used for patients that don't have a hearing loss, but actually can now wear ear level devices with minimal amplification or no amplification, and then be able to take advantage of some of these sound generators that are available within amplification or through streaming apps. Also, I think the availability of the smartphone, right? Just the apps themselves, one of the, as we're going through some of the regulatory documentation at the company, one of the things that I've been involved in is looking at sort of the number of apps that are available for patients with tinnitus or patients who suffer from tinnitus and what's available out there. So it seems like there is more information than there ever has been for patients with tinnitus. Saying that, obviously, too much information can sometimes be a bad thing. And so I think the most important thing is to look for information that is backed up by science, or as you were talking about, Ben, with regard to neuromodulation. There's a variety of other options that are available out there that I sort of communicate with my students, or my students and I say communicate sort of through some of the research readings that we have, looking at some of the different options that are available for tinnitus patients, whether it be some sort of medical, going through FDA approvals, such as the vagus nerve stimulation in conjunction with auditory stimulation to try to result in some neuroplasticity or reorganization so that tinnitus is not as observable. In addition, the use of some of the different types of sound therapy that are available. And so there's a lot of research that's still being done, finding out what is the best sound therapy for tinnitus. And as I tell my students, we're never going to find that silver bullet that's going to help everybody. But the fact that we do have a lot of the options, the different types of sound therapy available, whether it be wind noise, air noise, water noise, or even just white noise for some patients, we have a lot of flexibility for the patients, and it's also available out there.
Yeah, Jack, you touched on some important points. And to be honest, in my experience working with people and communicating with people who have tinnitus from all over the world, the first thing, there's so much information out there, and it's easy to get distracted to follow something that seems like it's going to be a cure or an easy fix, only to then have, unfortunately, wasted a lot of time and being led down the wrong path. Now, the second thing you brought up, I wanted to touch on is sound therapy, being that it seems so simple and it's not the immediate cure that some people are seeking, but it is one of the most evidence-based long-term approaches. And I'm referring to progressive tinnitus management from United States military veterans research, how using some constant or nearly constant low-level background noise has a positive effect long-term. That message is fairly simple, but there's so much noise on the internet. So what do you think, how can we get our patients to really focus on what's been proven and try to reduce the distractions?
First and foremost, I think it boils down to education. One of the first documents that I have my audiology students read is a clinical practice guideline in tinnitus that was put out by the American Academy of Otolaryngology, Head and Neck Surgery back in 2014. And this is a really good document because in addition to physicians, otolaryngologists, it also involved audiologists who did scientific literature reviews to look at what types of therapies and what types of interventions, I should say as well, were beneficial for patients. They looked at randomized controlled trials, they looked at single case studies and determined, is something recommended, is something optional, or is something contraindicated? And so, for example, one of the things that's always recommended for a patient that has tinnitus, first and foremost, is a hearing assessment, just so we can get a sort of general sense of what their hearing looks like, because there is such a strong relationship between hearing loss and tinnitus. One of the things which is kind of interesting that is optional was the use of acupuncture for tinnitus patients, given the research that's out there. In addition to sound therapy as being an optional component, cognitive behavioral therapy was definitely something that was recommended by the clinical practice guidelines. And again, this was put out in 2014, so about 6 years ago. And I know that since 2014, there has been some additional literature and research that's come out showing the additional benefits of sound therapy, put out by Dr. Henry's group within the Veterans Administration, as you mentioned, for example, progressive tinnitus management, as well as research put out by Dr. Richard Tyler's group at the University of Iowa. And so I think it's about education. And one of the other documents that I had one of my students read as well is the use of sort of herbal therapies, and if there's any really strong evidence, because one of the things that I know when I was practicing that comes up was, patients would ask me, should I take this herbal therapy to be able to help my tinnitus? And as it stands now, there's no strong evidence showing that herbal therapies do provide benefit for patients with tinnitus. We always strongly recommend before you take any sort of herbal therapy to contact your physician, to have a conversation with them about other medications that you're taking, to make sure that anything within the herbal therapy, if you are considered taking it, does not interact with any of your current medication.
Mm-hmm. Yeah, that's important. I find that these alternative treatments that show some promise, they typically have a grain of truth to them, and then it's a lot of gray area. So it is known that diet and overall health and wellness in the body and what we eat, our exercise, our stress level, that impacts our body's response to tinnitus. So that is true. The gray area is, can certain herbal supplements or vitamins that are out of balance, can those be the main reason to improve tinnitus? So I think that I see this in a lot of different alternative treatment therapies. There's typically a grain of truth, but a lot of gray area. Is that what you found as well?
Yeah, I think I think that's exactly true. I mean, not to focus too much on the herbal therapy aspect, but they're one of the components in many of the herbal therapies is zinc. or ginkgo biloba. And so while there may be research out there, showing that there might be some benefit for patients with tinnitus, there's not real strong randomized controlled trials showing benefit with zinc or with ginkgo biloba. And yet, people will latch on to a little bit of the science that is out there and then make broad strokes as far as, something being beneficial.
So what's your recommendation for someone with tinnitus who finds one research article with a relative, and they don't have a Ph.D. background or a doctorate or a scientific background to be able to analyze the validity? What's your advice to someone who finds one research study that seems to have a promising treatment result for tinnitus? How can they validate that? How can they make sure that's coming from a good, reliable source?
I think first and foremost, either have a conversation with your physician or with your audiologist about the article. These are specialists in the realm of tinnitus, more specifically otolaryngologist or your audiologist. The other thing is to look at professional organization and what the recommendations are. So the American Academy of Audiology, for example, is one. The American Speech Language and Hearing Association, as far as audiology is concerned. Again, the American Academy of Otolaryngology. These professional organizations will typically have statements about some of the recommendations or some of the information out there on tinnitus. So first and foremost, I would say go to the experts to have these discussions, or to look into the expert professional organization websites to glean more information.
That's
You're
very
exactly
nice.
right. It's very difficult to look at articles sometimes and be able to determine, based on the results and the end, do they have enough power to show a benefit? So I think it's just talking with the experts and having a conversation with them.
That's good advice. So now let's talk about the experts, some of whom you've been a part of developing their understanding, as you have been a lecturer, professor to them. So how much does the average audiologist know about tinnitus? And I say this because it's very common for someone with tinnitus to go to their audiologist or their primary doctor or their ENT doctor and feel that that doctor hasn't shared that they know much about tinnitus. So what do you think? How much do these different specialists actually know about the full treatment, the full management of tinnitus?
I think from my experience within the realm of audiology, I think audiologists are trying to gain more information on tinnitus. Definitely, speaking as an N1 for myself, when I was going through my graduate program 20 years ago, tinnitus was very lightly covered. But then again, we didn't have, while there was research out there, there's been a lot of research just in the past 20 years. And I think it is that area that audiologists see that they can potentially have an impact on the overall well-being of their patients with tinnitus because of the connection between hearing loss and tinnitus. So I can tell from the presentations I do, the number of people that attend those presentations on tinnitus specifically, there is a thirst out there within the profession to learn more about tinnitus. And knowing from my course and what is required in the class that I teach so that the university can still maintain accreditation, and what's required within the realm of tinnitus, that the students are getting a great breadth of information in tinnitus. Now, nothing, as with any graduate program, additional training is needed when you graduate. We can't teach them everything about everything, unfortunately, but at least there's a strong foundation to understand how to glean more information, how to look for more information. So, I think it is that area in audiology where people want to learn more about it. And I think audiologists, one of the great things about us is that we're a very ethical profession. And so, speaking for myself, I know that if someone approached me about a topic area that I wasn't very comfortable with, I would refer that person to a friend of mine in the profession who was a specialist. Rather than try to lead them down a path that was incorrect, we need to do the ethical thing and be able to refer patients to those audiologists that do do the additional training, do the additional learning to become specialists within tinnitus.
Yeah, thank you. That's definitely important. And part of our collective mission is to have more resources that are evidence-based so people who either go to their doctor or look online can can save themselves time and stress living with bothersome tinnitus and instead have a trusted path to continue forward with some confidence of where they got that plan from. So, what do you think is the most compelling research that supports trying hearing aids for tinnitus relief?
I mean, there's been, even in the past 5 to 10 years, there's been quite a number of studies that have come out showing benefit. Searchful in 2010 showed that patients with tinnitus and hearing loss who wore amplification actually showed an improvement in their tinnitus handicap over those patients that did not wear amplification. In addition, there was a Dr. Henry article that came out in 2017 that showed that patients with hearing loss and tinnitus did better with a hearing aid and a sound generator than just a hearing aid alone. And so I think it's, again, going back to the idea that hearing aids are now not just amplification devices, but hearing systems themselves. And I know from our company, putting a lot of functionality in the GN ReSound hearing aids to be able to help tinnitus patients. It's not just the amplification of sound, but also these incorporation of sound generators in connection or in cooperation with your audiologist going through one of these tinnitus therapy programs.
Yeah, thank you. Just as we are trying to educate the consumers based on the research, there's also manufacturers of devices who are trying to produce technology that can use the research to support patients as well. You work for one of the major hearing aid manufacturers in the country, in the US and in the world. Would you be able to comment on how your group and the hearing aid manufacturers in general are using evidence to support devices for tinnitus?
Oh yeah, I mean, it's, as technology improves, we're able to implement and apply different types of sound therapy within our hearing aids. So as a company at GN, the research guides our research and development in many cases. So for example, when our hearing aids first started out, I should say when we first implemented the use of sound therapy within our hearing aids about 10 years ago, it was more at a very basic level at about, and what I mean by that is providing a white noise, which covers many, if not all, the frequencies or pitches. But then as literature came out showing that in some cases, white noise wasn't the most preferred noise for patients with tinnitus, actually more water noise, air noise, wind noise, then we were able to actually implement and put those sounds within our amplification, within our hearing aids, so that patients had the opportunity to be able to select what sound therapy or what sound quality worked best for them as far as their tinnitus. And going back to the point that you made, it's not just the sound that they're listening to, but maybe the overall quality of sound that reduces the stress in that given moment to make the tinnitus seem not as noticeable for them. Speaking for myself, I know that I incorporate some of our tinnitus therapies. So for example, the tinnitus, the ReSound Relief app specifically, it has a variety of different types of sounds that the patient can be able to use, or the person suffering from tinnitus can be able to use, to be able to bring down their overall stress level, hopefully mask the tinnitus, in some cases potentially mask it out, if not actually provide just a little bit more noise in the environment to make the tinnitus seem not as perceptible. In addition, we also have components that involve meditation to incorporate relaxation, as well as some image therapy as well. One that I'm thinking of specifically is it shows the video of a roaring fire, and you can listen to the roaring fire in the background, and it can have a soothing effect, which is kind of interesting because just recently I learned, and as this app was probably being developed, that watching a fire can actually reduce someone's blood pressure. And I say, a fire like within our app, or watching sort of a fire in your backyard, in your fire pit, can actually reduce someone's blood pressure. So just the overall sound quality of this may be able to reduce the stress level in an individual in a given moment to make their tinnitus perceptible.
Very helpful. That is the most common app that's recommended for tinnitus relief. It is free. It is called ReSound Relief. You can find it on Google Play or on the Apple Store. Now, question for you guys internally, maybe you know this, maybe you don't. Do you track the user data and the preferences for all of the adjustments through the app? Because as you said, we're trying to figure out what sounds help tinnitus the most. It sounds like you guys have a huge amount of potential data through that app, no?
Potentially, and that's probably above my pay grade at this level, as far as having access to that kind of data. But I think one of the things that we are trying to do as a company is to provide and to focus on those resources that really help the patient. So I know that I think we're trying to glean more information, potentially to be able to help drive some of this. And I know through some of the literature reviews that I do, looking at some of the information out there to be able to help drive some of the research that's coming out within our tinnitus component. So yeah, hopefully it's out there, again, probably above my pay grade at this point, but there's a lot of data, so hopefully something's being thought about at the higher level.
Amazing. And yeah, I just pulled up the app here on my phone. You can see that there's some basically different kinds of sounds, and you can click the different sounds and then it plays the sound. So cool stuff. And what I learned, which I didn't realize, was that you don't need hearing aids to use the app, and you don't even need ReSound hearing aids to use the app. So any device that streams Bluetooth, you can listen to relaxing sounds and a large library of them. So that is really beneficial. So thank you guys for putting that together.
Of course.
Yeah. Last question here is, right now we're in 2020. We're in the end of 2020. As a group, as a hearing aid manufacturer, and as someone who teaches tinnitus coursework, would you like to comment on any kind of market trends or research trends for the next few years in tinnitus, hearing loss, or hearing aids?
I think the biggest thing that we've sort of seen is this idea of personalization. And I think giving the patient as much flexibility as possible is kind of key. So for example, within our hearing aids, we have something called, within the GM ReSound hearing aid, we have something called the tinnitus sound generator. And so this is the feature or function within the hearing aid that allows the audiologist or hearing care professional to be able to turn on the function to be able to provide sound therapy. And so once the audiologist or hearing care professional actually turns that on within the fitting software for the hearing aid, then the patient has the flexibility within our Smart 3D app to be able to pick whatever sound they want. So even though your HCP may turn on white noise for you in office, you as a patient have the ability to pick a different sound that you may prefer in a given moment, or also to adjust the level of that sound therapy in a given moment as well. So I think the key is personalization, individualization. So making the hearing aids work best for that patient in that given moment in time to help resolve or relief, provide some relief to the tinnitus.
Yeah, thank you. And I can attest, I have a client that I work with who is a musician who developed tinnitus after decades of loud music, and he has a hearing loss and he has very loud tinnitus. And he shared that using the hearing aid with a sound generator, a soothing sound, for him that is very useful when his tinnitus spikes, and he seems to be losing control over keeping his concentration and his focus and his energy when the tinnitus is so loud. So having something on his ear that he can be around other people, not distract them with a noise, but listen to it in his ear, is huge for him, a really big improvement in quality of life. So just to bring in a real story about how this technology is helping people, that is something that comes up quite often.
Yeah.
All right. So Jack, how can individuals find your work or find the work of your group, GN ReSound?
I think a simple Google search will for ReSound hearing aids will bring you to our website, and then from there you can learn more about sort of our tinnitus solutions that are available. In addition, as you mentioned, we have the ReSound Relief app that's available in the Apple Store or in the Google Store online to be able to download it to their phone to play around with it. And so this is a great tool to be able to learn about some other recommendations for tinnitus relief, such as meditation, relaxation, as well as the sound therapies that are available. And it also does have a kind of a little hearing test in there as well to determine if you need to be seen by an audiologist for a more advanced diagnostic hearing assessment.
Thank you so much, guys. This is Jack Scott, Ph.D. audiologist and current senior audiologist at the GN ReSound Group, previous faculty and lecturer at Northwestern University in Chicago. We thank you so much for joining us. This is episode 5 for the Pure Tinnitus video podcast series. And if you enjoyed this episode, I encourage you to go back and watch episode 3, where I interviewed Troy Cascia, who is the lead senior audiologist at UCSF Tinnitus program in San Francisco, California, and one of my biggest mentors in my own personal journey starting Pure Tinnitus. We're going to include that video right here after this is over, so hang tight for that. And thanks so much for watching, guys. Talk soon.